Congressman Joe Sestak is with us with a lot to talk about with him here on the Big Talker 1210. Congressman, welcome in.
Hi, Don. Thanks for having me.
You are welcome, Congressman. Thanks for joining us. Are you here? Can you hear me, Congressman?
I sure can.
Okay, good.
Cutting out for a moment. Am I okay now?
Oh, you're fine. No, you're
okay,
fine.
Great.
We're loud and clear. Congressman, breaking news about an hour or so ago, or you may know a little bit more about this. CBS News reporting that the president will give McChrystal the requisite troops that he requested, or close to it, somewhere in the mid-30s, I guess, for Afghanistan. They'll go in the new year. Have you heard that, and do you have any thoughts on that, if that's true?
I've heard the same report, and I actually think the president was going to make that decision. I think it's the correct one.
Okay.
As long as he also does the following: make sure that this mission is focused strictly upon the elimination of al-Qaeda and its safe haven in Pakistan. Second, that our goal in Afghanistan is merely to leave behind conditions which, while won't be ideal, they at least are ones that aren't hospitable to the al-Qaeda. And third, that there's an exit strategy that can trigger, benchmarks that can trigger an exit strategy if we are not being successful. And I think he's done the right thing. There is an opportunity there still remaining in order to eradicate that safe haven in Pakistan, and that's our mission.
Do you believe that we can negotiate with the Taliban?
Without a question. Here's why. The CIA has said in hearings that there's 20,000 Taliban that's in Afghanistan. Approximately 70% are there for a wage. They're there not because they're ideologically bent. They're there because they make 3.5 times what an Afghani police officer makes, which is an Afghanistan police officer makes a pretty good salary for Afghan, and they make 3.5 times. Mm-hmm. So what you've had is Tajiks who live in Tajikistan that used to live in the oil fields of Russia. And then with this great recession around the world, they've come back home. They have no money, so there's a Tajik warlord who's gone to the Taliban. He hires them. So our key here is to eradicate, eliminate, so neutralize, whatever the term you want to use, those 6,000 in Afghanistan are the bad Taliban, the real bad ones. The other ones is where you buy off. When I went into the ground in Afghanistan early in the war, I sat alongside, went in with a guy from the CIA who had a suitcase full of millions of dollars manacled to his wrist to buy loyalty. That's what we were doing. And so there's going to be a way, as I said, not to leave ideal conditions, which if we had kept our focus on that war instead of diverting to another one, we could have left behind a decent society. But now that's too hard to do. We just have to leave behind conditions that aren't that hospitable to al-Qaeda coming back. Once we eradicate al-Qaeda on the other side of the border and use our forces there as a pincher movement almost, where they're keeping the border semi-closed as the Pakistanis, which they finally are beginning to do, use their army to eradicate the Taliban and the al-Qaeda on the other side.
All right. Well, thanks for the comments on that, Congressman. Now to the health care vote and I saw you on several shows on Saturday. What kind of constituent response out in Delaware County are you getting? Can you, if you had to boil the numbers down, are people in favor of your vote?
Don, if you don't mind, this phone's beginning to cut out.
Sure.
Can I quickly switch to another phone?
Sure.
They've got it in another office.
Okay, sure. Yeah, sure. That's fine. That's fine.
30 seconds. You cut out. I may be clear. I'll be 30 seconds.
All right. You are fine. Fine. Okay. We'll do that with Congressman Sestak. All right. Let me go back to Congressman Sestak, and we'll start to take some calls with him. Hey, Congressman, we were talking about the vote on Saturday night and asking you up to the vote and after the vote, can you give us an idea of the constituents that contact you? How is it running in your district, support or not for that vote?
Sure, and I apologize. We had a new phone system established here the other day, and sometimes it causes problems. It's not quite settled all the bugs out. I would say it was interesting. We had those that call themselves the Tea Partiers showed up down in Washington. I had 4 separate groups that I met with down there who were vigorously opposed to this. They came down to that rally that was down there. But I would say that of those that have written in, it was probably a slighter majority that were opposed to it than were for it, of those that had emailed in or not, called in. I think it was running about 55-45 or so, 55 opposed.
Okay, now when you get something like that as a congressman, certainly, I don't think that matters necessarily that it's 55-45, that you have to vote, waiting till each vote comes in before Sestak decides. But when you're hearing that and hearing some of the really passion that's out there against this, what is it in your mind then that made you make this a critical vote?
Well, I got in to this, as you know, because my daughter had a brain tumor, similar to Senator Kennedy's, and I wanted to pay back. This was a personal debt to work that everyone had the same accessible health care plan that I did in the U.S. military. So when I got in, first off, I had up on my website basically the outline of this health care bill, because it's based on the Massachusetts health care plan. It's almost identical. And I had, up before this summer, approximately 8 town halls or summits on health care. I actually put out several mailers, what I felt over the 2 years, and I was very out front about what I believed in, what I ran on, and it was this. Now, during the summer, I had, during August, about 10 town halls. You were one of them that I don't conclude because it wasn't really my personal town hall, and I listened. But all the evidence showed me that having listened, having studied, that this was the right thing to do. And so I am a representative. I owe it to listen and to explain. But then I'm a congressman. And then I have to, having listened to different opinions, and there are often different opinions on almost every issue, then vote to what my judgment says, having listened what's best, and let the chips fall as they might.
Okay, now let me ask you, though, Congressman, they're close to 2,000 pages, or some say it's over that. That tells me something is wrong here. That's a warning sign of obfuscation and other complication. If this should be just clear what Joe Sestak and others are voting on, that's an awful lot of words and obfuscation that's in there, it seems to me.
Well, Dom, would you say the same thing when I told you that the op order, when we had special forces lift off my aircraft carrier to go into Afghanistan, was well over 2,000 pages? When I tell you that the manual by which we ran the nuclear power plant on my aircraft carrier was well in excess of 2,000 pages.
I might say that because you have very, very specific things here.
No, this is a specific thing.
All right,
this has to do with millions of Americans. So my point is, if you think that we are going to be stymied because of length, we could go to a single piece of paper, and try to get it on one piece of paper.
Well, not one piece, but, a few hundred pages.
Dom, almost every bill that goes through Congress is hundreds of pages. And so I understand this argument about length, but it's a false argument, and I think you and I know that.
Oh, I don't know that, Congressman, but let me take you to another point. We disagree on that one. The Saturday night vote, that didn't sit well with some people. What was your sense of why it was necessary to do that?
Oh, I voted not to adjourn or until we were done.
Okay.
Look, we've waited since 1995 when, as you well know, and the president, now Democratic Senator Arlen Specter and others stopped President Clinton's health care plan. Nothing has been done since 1995. We've waited. 10 million Americans have lost their health care plans, private health care plans, in that period of time. 14,000 lose it every day. Look, this outline of this bill has been around for some time. As I said, I put it on my own website, the 11 major points into it when I got into the race. Anybody who has been down there doing their job, studying it, working it, this bill has been around. It was only marginal changes since the one we passed last July. And so my take on it, Dom, is that, this is a pretty complex world. It's a pretty tough world. And making sure that we are doing our job well by making sure it's clearly laid out and having to legally actually reference other previous laws has to do with why this document's so long.
All right, fair enough now, Congressman, and I commend you for putting up the major points, but what about transparency? 72 hours in advance, letting people read it, letting the American people see what they're paying for.
Well, that's why we voted Saturday night, is this bill went up 72 hours before that.
Yeah, but it wasn't put up on the Internet. I can't find anything out there to access that for people. Do you think there was transparency in your view that your constituents could read this fully?
It was put up and available on the website 72 hours prior, all right? Now, I don't think 72 hours is enough, but this bill, if you had read the previous bill, for example, when it came out and I got it, I stayed up that night until about 2:30 in the morning with my staff comparing what the changes were. They were on the margin since the one that we did in July. And, I mean, they really were minor changes, relatively minor ones.
Okay.
So, staying through Saturday night, heck, if we're in the middle of this great recession, I don't even think we should be out of Congress today.
All right, can you take some callers, Congressman? You ready to go?
Absolutely.
All right, Ann in Delco, one of your constituents, is with us in the Big Talker 1210. Ann, you're with your congressman. Go right ahead.
Oh, well, I just want to commend Congressman Joe Sestak. I think he did the right thing. This mailer he sent out, an update from Congressman Joe Sestak on health care reform. He does a fabulous job of keeping his constituents informed about how he feels. You never get a vote from Joe Sestak that you think, wow, where did that come from? You really get a sense of, he puts it right out there. Talking about being transparency, this is a congressman that lets you know how he feels, and he's very passionate and incredibly intelligent congressman.
All right, Ann, well, thank you very much. I don't know if the congressman will stipulate all the above then, Ann, from your call. That's we're reading into the record, okay?
Okay, and even my elderly neighbors across the street who normally don't vote his party commend him for, they say his office staff is fabulous when they've called about health care issues.
Thank you, Ann. Thanks very much. Jerry's in Upper Darby. He's in on the Big Talker 1210. Jerry, you're with Congressman Sestak.
Hi, Congressman. I'm one of the 55% that has consistently called your office to urge you to vote against this. Again, I'm a self-employed accountant. A lot of my clients have told me that, yes, even though the bill said that it didn't refrain you from keeping your health insurance, they've told me that what they'll do is not pay. They'll drop the health insurance and pay the fine on that because it'll be cheaper for them. So the point we're talking about, you can keep your health insurance. It's not quite right. I mean, it doesn't stop you from keeping it, but people are going to go away from the small business employers are going to go away from covering their employees. And the other thing too, I have my own insurance through the local Delaware County Chamber of Commerce, but I can't even go in Pennsylvania and find out what Highmark will offer me out in Pennsylvania. So I don't know why we didn't just allow to have competition, instead of creating this monstrosity that bureaucracy we're going to be doing.
Well, you raise a lot of good points. First off, if you are a small business below 100 workers, you're not going to be required at all to provide health. Let me back away. If you're a small business that has a payroll of $500,000 or less, you're not required at all to provide health care.
Understand that.
Okay. And so I don't know if you make a self-employed more than $500,000, so you won't have to. Now, others. Here's what we do.
I'm talking about my clients that have payrolls greater than $500,000.
Okay. Now, in their case, what we do is the following. Presently, they pay 18% more in Pennsylvania for their health care than do large corporations like Boeing because they can't spread the risk. So if they have 100 or less employees, what we let them do is put their employees, and they can choose which plan they want on this new health insurance market, because these are national to spread the risk, right, in this new health insurance market. They can click the public option, or they can put Cigna or pick Benchmark if they want to. That will put things in there, and you spread the risk across national pools. Now, so that is going to bring down the cost for small businesses because they are presently paying 18% because you have 5 employees and one has, like, cancer, your rates go way up. And now they'll spread the risk nationally. Second is we mandate for larger corporations, 100 and above, that you have to keep your private plan paying 8% fine. The reason we picked 8% is because that actually does work out to be 8% of the payroll more than if they provide health care, because health care, they can deduct both the employees and their as pre-tax dollars. And so that's why we picked 8%, so it would be more if they didn't continue to pay it. And finally, I like your idea about breaking down state regulations. So, for example, you could pick a plan in another state. The reason we Well, that is another way of doing it.
But
when the other party suggested it, what they didn't want to do is they didn't want to set the national minimum level of benefits. So, for example, if you bought once you do that, all the insurance companies' headquarters will have to domicile their headquarters somewhere. So they'll go to Alabama, for example. Alabama doesn't have the right of appeal. So if you buy one with a policy in California, but it's headquartered down in Alabama, then you can't appeal when they deny you coverage for chemotherapy.
Thank you, Jerry. I'm going to move on to some other callers. Okay, let's go to Bob. Bob in Upper Darby, a constituent of the congressman. Go right ahead, Bob.
Hi, and thank you for taking the time, Congressman. I have a lot of respect for you and the work that you do, although I couldn't possibly more strongly disagree with your post. You're a good guy. I just think you're wrong on this one. My question is, and this has really been bugging me, if it's so transparent, if it's so, let's get it through. Dark at night, Don brought this up, dark at night on a Saturday night, come on, I don't buy your explanation at all, but we got to get this done. I think it was to hide it from people. This isn't a wartime piece of legislation. We're not in a crisis. It has been going on since 95. Why the rush? Just to get it through is my opinion, but I'd love to hear your side of it.
Well, I guess as I listened to you, if we had sat back and waited 10 more days, I would have probably been certainly bought off on it. We had agreed, because the other side had asked, and I think we should do this for all pieces of legislation, to have it up for 72 hours. It was available on the website for 72 hours. The changes were marginal, so I was comfortable with it, and I had been out and about explaining it. I don't have, I guess we should fight for it to be 10 or 20 days. There aren't many pieces of legislation that many people get to go all the way through normally, but this is such an important one. I can't disagree if it's another 10 or 12. I was happy because they at least gave 72, which often doesn't happen, quite frankly. Sometimes I'm reading a bill at 4 a.m. in the morning because it comes out at midnight to vote on the next day. I can't defend the system real well. So I think you have a good point.
Thanks, Bob, very much.
72 hours to 96 to this, right. You have a decent point.
Well, I would hope you or somebody else would champion the idea, too, that you guys should not have to get a bill of this kind of complication, money, et cetera, healthcare otherwise, and I know you agree with this, and have to read it at 4 in the morning. This is nonsensical.
Yeah, but if I could, Dom, I want to stress on this bill. Yes. I have been following this particular bill, since last January. So and I'm not saying every constituent had the opportunity. I was intimately apprised of this, and I knew what was going to go into the bill because I was at meetings on it and meetings on it and meetings on it. When it came out, I'd elected to stay up the first 24 hours to make sure I knew it well. In case I had questions, I'd get them fixed the next day.
All right, let me take another call.
I want to say I had plenty of time to go through this bill myself over the past 6 or 8 months because it didn't really change very much between July and here.
Gotcha. I'm talking about as a broad principle, we agree. This is no way to run the Congress with what you suggested, with bills coming to you at the last minute. This is childish stuff that this should be thoughtfully done, not just this, but every bill.
True, but on the other hand, you have to recognize there's 5,000 bills submitted every year. Mm-hmm. And, you just mentioned the gentleman who spoke up. I get 250 letters a day or emails. The last week I've gotten 800 a day on this health care bill, and we answer every one. We keep our constituency office open 7 days a week because we've handled over 12,000 constituent cases. You can only, this is a pretty hard job if you do it well, and I love it. It's the best job you can have. You can't be in the Navy.
All right, let me take another call for you, Congressman. Don is on the Big Tucker 1210. Don, go right ahead.
Hey, Congressman. First off, if the president does approve those 40,000 troops, I sure hope that they are given the permission to defeat al-Qaeda and that they aren't treated like UN peacekeepers. But my comment on the health care bill is this. Right now it appears that health care is the fifth. It's not even in the top 3. It's the fifth issue of concern to the American public. And what I would like to know from you, though, specifically, is this: the Sestak amendment passed just before your vote on the bill. Did you vote for the Sestak amendment? And what are you going to do with Diana DeJed, who's a representative and who has signed a petition for the White House with 40 other congresswomen? What if she gets her way, and that amendment is precluded from in the final bill? Are you going to vote for or against?
All right,
it?
Don, slow up for a minute. For listeners, before the Congressman answers, the Stupak Amendment, we agree, Congressman, essentially was trying to iron out and keep away any federal funding of abortion in any way, shape, or form.
Yeah, first on your 40,000 troops, can't agree more. The sole mission of them is to eradicate al-Qaeda, and we do not follow, because the UN isn't even there, but we do not follow UN rules of engagement, nor do we follow some of the rules of engagement the Germans there or other nations do. We do follow our rules of engagement, which are safe for our troops and for destroying the adversary. Second, I voted against the Stupak Amendment. I voted against it because it changed the present situation of the Hyde Amendment. What we had done in the bill is said that if we will subsidize those who are uninsured up to 400% of poverty level.
Congressman, the reason the amendment was introduced was because it was believed by and is believed by most people that the Hyde Amendment would not carry sway on this piece of legislation. So I'm appalled that you actually think American taxpayers should pay for abortions. I'm very appalled by that.
Oh, just let me finish if you don't mind. Here's what we put into the bill, and you can disagree on this, but here's what was on the bill before the Stupak Amendment. That if an individual is subsidized, and some of them would be, up to 400% of poverty level, if they're uninsured, they would get up to and up to 400% of poverty level. But they still have to pay some of the premiums under their own money. That's a requirement. This isn't government covering it all. They got to pay a certain percentage. That if they elected to have an abortion, that money out of their own pocket is set into a separate account, and only that private money can be used for an abortion.
All right, Congressman, let me stop you there, Don, and hold up. Here's the problem with that, though. People don't believe that the government will be able to keep that sort of accounting, particularly as things wear on and things would get muddied together, and you'd have Americans who oppose abortion, they believe, I think correctly, funding it.
Well, see, I don't have a hard time believing that we aren't good enough to set up a separate account to collect money from the private premiums that sits into this account. And if an abortion is requested, which under the law it's permitted, that is their own private money. I am a strong believer that, yes, you can partition the money, and that's what we had in the bill.
All right, Don, last word. Go ahead.
The one thing I think is very important for the listeners to understand, and that is if that amendment is not included in that final bill, either way, you're going to lose the vote on this, because the 40 or so pro-abortion members of Congress are vowing now to vote against the bill if that amendment is included. And if that amendment is not included, you have 40 or so Congress people who say that they will vote to oppose the amendment on the opposite
side. Very well put. You are the first one who, at least in several radio interviews today and yesterday on TV, that has laid it out very clearly. Because of the strong beliefs on the respective sides, and I respect both sides, there is this contingent of 40 in the House relatively on each side that can stop the whole bill going. That's why there was an agreement in the middle of the night where it pretty much was along the lines of what I just laid out, and it was a little bit more, and my understanding, I wasn't in the room, but one representative said that they had gotten the Catholic Bishops' agreement. Somehow it came out of the room and fell apart. And to my mind, it would have kept more along the line of what I said, but with more firmness. So what Dom said, it definitely showed that the private money could have only paid for it. Unless they come up with something like that, you're right. This is a dilemma where you could end up with both sides stopping it, whichever way it comes back.
Thank you, Don. Thanks very much for the call. And Congressman, thank you as always, too. I am impressed with the details that you provided around this in endorsement of your vote, and we welcome you back again. I'm sure there's going to be several incarnations of this going around.
Dom, there will be, because it is so important, because it has to do with quality and life itself.
Absolutely. Thanks, Congressman Joe Sestak. Thanks for joining us.
Thank you.